Diabetes and cardiovascular disease. Diabetes, we call it, it's a vessel disease. Ultimately, the diabetes along with hypertension and high cholesterol leads to blockage of the arteries. It can be blockage of the artery to the heart, it can be blockage to the artery supplying to the brain. So that can result into either stroke or a heart attack or sometimes circulation of your legs. So it's very important that we make sure you protect your vessels. So that's the main way that diabetes is managed. Diabetes management is entirely to protect you from the vessel related disease. So it's very important that diabetes, I call it, is a beyond sugar disease, because it's very important to again control your blood pressure, your high cholesterol, and regular blood testing is required, including your sometimes a treatment test is required, and sometimes a carotid vessels Dopplers is required, along with the routine diabetes management. So the mainstay of diabetes management is that you get your routine test done, get your HbA1c done, get your cholesterol test done, and manage your diabetes aggressively to protect your heart. Because majority of the people die because of diabetes, because of heart disease or stroke or poor circulations. And sometimes the same circulation tends to affect your erection difficulty as well. So these vessels tend to get gradually blocked. So most of your doctors would give you good diabetes management medications, plus that it's very important to understand that we manage your blood pressure to protect your vessels, to prevent risk of stroke and heart attacks, and give you statins type of medications. Now there's a lot of discussion going around that we should take your statins medication on. Our scientific recommendations flatly and cleanly recommends that statins should be used in the majority of the patients who have got one or more risk factors for having diabetes and heart disease. So if you have 40 plus, and if you're smoking, if you have hypertension, if you have little raised high cholesterol, you may need indication for statins. Statins group of medications are very safe, and along with it, sometimes use aspirin. So besides diabetes management, it's very important to control your blood pressures, take statins group of medications, and sometimes take aspirin. Because if you ask me, the most important management of diabetes management is to prevent death and heart attack, is to use management of cholesterol, use of statin therapy, and taking aspirin. Besides the medical management, the most important thing in diabetes management is regular 30 minutes walk, 5 days a week minimum, and make sure weight is well controlled, and avoid fatty diet and eat more fibrous and fruits. The prevention of heart disease, which includes diet management, blood pressure management, cholesterol management, use of statin therapy, so that we can in future prevent the risk of stroke and heart attacks. And if you already have a stroke or heart attack, it is very important to take all these medications prescribed by a specialist.